right. Hello, everyone, and welcome back. Today, I have with me an amazing midwife that I have had the honor to work with at many, many births in Portland, Oregon, while I was a doula there. And yeah, I'll let her introduce herself. So, hello, Janelle. Who are you?
Hi, Allison. My name is Janelle Banderaga Rice, and I am a CPM and a licensed midwife at a birth center here in Portland, Oregon. Do birth center births and occasionally also do home births.
Oh, so how did you get into that? Like, what was your calling to become a midwife?
I think it's actually kind of two answers to that question. One started when I was little. My mom, well, I was 7 when my mom had my sister. I just have one sister. And I really clearly remember my mom having this book called The First 9 Months of Life. And I think nowadays, if you go find it, because it's a really old book, this was back in the 80s, the copies are really small and black and white, but she had this big, vibrant color copy. And it was all the photos of, if you've ever seen pictures of embryos and fetuses in the womb, I forget what his name was, a photographer did back in the 70s, right? So these beautiful photos. And as a 7-year-old, just combing through this book, like this was the coolest thing ever. And of course, also this is pre YouTube and Instagram. This is 1985. So I think my mom recognized how fascinated I was and one day brought home a magazine that had pictures of a vaginal birth in it. And just my little 7-year-old brain was like, this is so cool. And then I wanted to be what everybody wanted to be back then. I wanted to be a marine biologist and maybe a nurse or maybe a kindergarten teacher. And then when I was 17, I was taking college courses so I could graduate high school early. And one of the professors brought in a big stack of catalogs from different universities and told people, like, feel free to take them or look through them. So I grabbed a couple and I was flipping through one of them, and I had a midwifery program. And it was kind of like this light switch of, oh, that's what I'm supposed to do. So I knew then, but when I got pregnant the first time, I was young, I was 20, and I was petrified. I was so, so scared. And I remember someone telling me, oh, there's no midwives here. So I, at that point, didn't even try to seek out a midwife. I just thought, well, I guess I'm just going to go with this OB that someone I know is going through. And, I had a really normal pregnancy. And then there was things that happened in my birth that I just didn't like, that didn't sit well with me later when I was processing, and kind of had that mind shift of like, there has to be a better way. Oh, and by the way, also I want to be a midwife, so let me start reading. So then I just started pouring through different midwifery books. And a couple of years later, I took a birth doula course, and then I started nerding out and going to midwifery conferences, and from there and there and there. So it was a combination of like, this is my calling, and also my own birth experiences that really, really, really impacted that too. So I signed up. So I was looking into Seattle midwifery, which now it doesn't exist anymore, but it was absorbed by another school. But I was looking into that program because I really, at that point, I knew I wanted to be a home birth midwife or out of hospital midwife. And so one of the prerequisites was a birth doula course. And so I took that in Seattle with Penny Simpkin, who, wrote so many amazing books, The Birth Partner, Pregnancy, Childbirth, and the Newborn. Like she's pivotal, right, in the doula world. And so I got an opportunity to learn from her. And then right before then, like literally right before that class, I found out I was pregnant with my second baby. So it lined up so beautifully of, learning this knowledge, through taking that class, but then also the reading I was doing on my own. And then now I get to try it out, right? And now I get to have a baby. And I chose a midwife who was a naturopath who ran a very, very tiny birth center, like literally one birth room in the back of the clinic. And I had a beautiful birth. I had a beautiful, straightforward birth. There was a complication. There was a shoulder dystocia. My little boy was a very chonky baby and his shoulder got stuck. And it was just so impressive. Like she resolved it so quickly. Everything was so calm. I was never scared. I felt so loved and so held and so well supported that it just felt like, yes, this is right. This is the way that, when people are able to, this is the way that we should be birthing our babies.
Mm-hmm. Mm-hmm.
Um, so after a couple years after that, I'm like, okay, now I have a 2-year-old and I have a 5-year-old, and I think I can start getting ready to apply for midwifery school. I have my prerequisites done and I applied and I interviewed, and then I get a phone call. You're going to get a letter in the mail. I just want to let you know you've been accepted. Oh, P.S. I'm pregnant again. So I was pregnant with my third baby that same week. And it just, at the time I thought I can do it. I can do it. Realistically, really, it made sense to wait, which I did. And I'm glad I did. And then a few years later, I had the same idea. Okay, I think I'm going to start getting ready. I'm going to figure out school. I'm going to apply. I'm going to do this. Just kidding. Maybe I'm going to have another baby. So I had 4 babies. And it was kind of like, I'm not going to have any more. And once my youngest is like old enough that I feel like I can do this, I'll start looking into it again. And really, actually what happened was in 2011, my grandmother passed away that spring. And I remember, and I was her first grandchild. We were so close. It really, really was so devastating. And that happened. And I remember thinking, she's never going to know if I accomplished my dream or not. Like, she's never going to know if I ever do this. And so that was kind of the kick in the pants that I needed. Like, we're going to do this. Like, we're going to do this. I'm going to do it. And that I did. A year later, almost exactly a year later, I started school.
Oh, that's so incredible. So did you have your third and fourth baby? Where did you have those babies?
So my first baby was in the hospital with an OB. The next 2, my boys, were both born in birth centers with midwives. And then my youngest was born at home with a midwife.
Okay. Oh, wow. And then you could like honor, you said your grandmother.
Mhm.
Yeah, so you could honor her, and that was that motivation you needed to just like start this big dream that she knew that you had.
Yeah.
Oh, so what was that like? What was midwifery school like in the States? Where did you go or study?
I attended midwifery school here in Portland, Oregon. There was a direct entry midwifery program called Birthing Way at the time. If you did it full time, it was a 3-year program, but luckily there were options to do it at a slower pace. So I did 4 years. So, and then in my 3rd year of school is when I started clinical training. So essentially, an apprenticeship, with midwives out there in the world. And so I started at the birth center where I work now. It was the best thing ever. Somehow I knew in my bones I was supposed to be there, and it was very intimidating. I knew it was a very high volume birth center. At the time there were, I don't know, like 5 primary midwives there. There were a lot of students. There was a lot of competition. And so it felt like a really, really big deal to be able to get on for that opportunity. And then they've just never been able to get rid of me. So
Oh, wow. So it was 4 years. Okay. Wow. Okay. So in this program, you don't study anything like being at a hospital. This is primarily birth center and home birth, midwifery.
yeah.
So how were those first births for you? Like having done birth center births and home births yourself
Yeah.
and a student in that environment, what was that like?
It was interesting. So, I mean, at this point, I had done some doula births, maybe like a dozen, give or take. And so it wasn't it was still new. Like 12 births is not very many births, right? It's nothing to write home about, but it's something.
It's
Um,
something.
it's something. The first birth I had was a retained placenta with a hemorrhage. And so that it didn't scare me, but I remember for several days not being able to get the smell of blood out of my nose, like because
Oh
I'd
my God.
never experienced that before. And then it was just interspersed, just like birth is, like a really straightforward birth, beautiful birth, and one would transport, and then a handful of more straightforward, beautiful births, and then there would be a hemorrhage or something else spicy that would happen, and I was doing probably averaging 4 births a month for those 2 years. Every once in a while a little less, every once in a while a little bit more. um and so I had there were so many opportunities during that time, like just so many different experiences. And then I also was not just working with one midwife. I had multiple preceptors. So I got to see, oh, well, so and so does this way, but such and such does it that way, and kind of, get to pick and glean how I would want to do things later on, which was really cool experience as well.
Oh, I mean, that's gotta be the coolest thing ever, that just witnessing other midwives and taking what you want from some and leaving some other things, and just creating your own identity within that.
Yeah.
Uh, so then you graduate and then you start working at this birth center. And so walk me through, what does it look like being a midwife, having a prenatals up until the birth and postpartum?
So a lot of out of hospital midwives, we schedule our appointments for an hour. So I'm sure a lot of people can relate that have kind of hospital-based care. You go in and you pee in a cup and you get your blood pressure, you get your vitals done. They listen to the baby, they measure, they palpate. You're lucky if you have 20 minutes with anybody, let alone a full 20 minutes with a provider. So having a full hour gives so much space. It gives so much space. It's really comes down to relationship-based care. Um, for me as a midwife, I love knowing when I'm walking into a birth that I know this person. Like I know them, I know who they are, I know the things that are important to them. They know me. Like it's not a stranger walking into this really intimate, vulnerable environment, because we've had so much time to spend talking about, anywhere from, concerns and fears and anxieties and the happy things, in life, but also just silly stuff, right? Like what's for dinner tonight, or what are you doing this weekend, or what do you recommend for, I don't know, just like silly stuff that you would talk to. Like it feels like spending an hour with a friend, and that is typically my intention. Like I'm not coming in here to do a job. I mean, I am, right? But I want it to feel like I'm hanging out with a friend for an hour, and then that makes it fun.
Yeah.
um, and most out of hospital midwives follow the same prenatal schedule that everybody does, right? So, seeing families monthly until they're about 32 weeks, then biweekly until that last month of pregnancy, and then it's weekly until having a baby. So, you know, depending on when a family starts care, meeting with someone anywhere from like 10 to 13, 14 times, sometimes during that pregnancy for up to an hour, there's a lot of time to ideally, hopefully develop that relationship with, which I think is really important.
Mhm. Oh yeah, I remember just as a doula, like having supported births, I would always come in with prenatals. I loved joining the prenatals at the end of pregnancy because a lot of stuff is coming up for people and they have questions, and it's also just to get a relationship with the midwives, so that I always felt it was just so holistic, and the questions that you all would ask, and everyone would be always so comfortable.
Really so vast. It really, and I really like it. I really like that because it keeps it less boring. It keeps it less boring to have, Portland, Oregon, we have a wide variety of people here. And our birth center, Alma, is we're kind of like smack dab in the middle there. They're pretty centrally located. And so anywhere from, families that are more mainstream that don't want a hospital birth for any reason, maybe, anywhere from like, I just don't like hospitals, to maybe they've had some medical trauma, or maybe they've had a history of sexual assault or something that they're just like, I would prefer to avoid the hospital. But I'm okay with doing all the things that are recommended, like, just kind of standard, right? To families that will decline all, if not most things, families that are very conservative religious families, to, crunchy hippy dippy families, to queer families, to trans families, to single parents by choice. Like, I mean, kind of like almost anything you can imagine, we end up seeing. And I love it, because then it checks me and my assumptions. Like, I won't go in with making any assumptions about anything or anyone. Like, I want them to tell me who they are, and I want to be the midwife that they need me to be, whatever that looks like for them, based upon who they are, like as a whole picture for their family.
Oh, beautiful. Oh, yeah. And I feel like they're also, I mean, a lot of people choosing birth centers are really well educated.
Yeah, I appreciate that, as well as, even if someone doesn't know about whatever subject we're talking about, that I can confidently point them to resources. And they're going to come back with good questions. Or not too long ago, I had a really, really, really young first time mama, a teen mom, and who was so educated and so empowered, and like really just such an advocate for herself, that it just blew my mind. We do see people that are more, and like, and then the opposite of, like, really not the opposite, but the really well educated, like, older people choosing to have babies later in life, folks that are in their 40s having their first babies for the first time, their first babies, or maybe that ended up needing to choose IVF as a route to get pregnant, so had a really highly medicalized conception. So now they want to do something different for their pregnancy and for their actual birth, so it is really, really fun that way. And we do really encourage families to have doulas. We really, really, really do. I tell people all the time, I've never seen a situation where a doula is a waste. The data, the statistics, all of it backs up doula support as, reduced interventions, so many different things. So please, 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 please have a doula, whether it's your first baby or your third baby. I think it's needed, right? And because the role of a doula and a midwife are so different, right? Like, I can do doula-like things, but at the end of the day, the clinical picture, for lack of a better term, that always has to be my priority. So we attend people, whether they're coming to the birth center or we're going to their home, once they're in an active labor pattern. Some of that sometimes is based upon their history, their birth history. So if it's someone's third baby and they have a history of a fast labor, maybe we're seeing them sooner than that. But a general rule, right? They're in a nice, good, active labor pattern. One of the reasons is just us as mammals, right? Like, at the end of the day, we're mammals. We don't do well being observed.
Mm-hmm.
And I tell people all the time this example, like, have you ever had a cat in your neighborhood have kittens? What does she do? Like, she hides up under somebody's house or in a closet or in a dresser drawer to have her kittens. Like, we are the same way. And so being kind of out in the world while we're in a more early labor pattern, or being observed by a bunch of people, it's not really conducive for oxytocin. So, we stay in really good contact in those early labor hours. Once people are feeling like, oh, I need a little more support, but maybe it's too early to be attended by midwives, talk about doula support as an option. And then, or either arrive at their home or have them come at the birth center in active labor. And then it's really holistically what that family needs. So at the very bare minimum is, doing intermittent auscultation, which means we're listening to the baby every 30 minutes during active labor, to hear about how that baby is tolerating labor. So the goal is to, kind of see what that baby's baseline is. And then throughout the contraction, what does their heart rate do? How are they tolerating? What changes are happening, so that we're able to get some reassurance that this kiddo is still healthy. It's a low risk labor still. Um, vitals, assess how people are coping, that they're remembering to eat and drink and pee and all those kind of basic things. And sometimes in those early junctures of coming in, a family, they're doing their thing. They feel they're well supported. They have their team around them. Maybe they don't need a lot extra from me. And if that is the case, I'm quietly sneaking in and out to do those things, trying not to disrupt them. But I really do try to hit to them like, hey, if you need more support, I'm here. Like, I remember someone once, I'd listened to her baby. She was in the tub, just coping beautifully, this beautiful labor. And I'm like, okay, like your baby sounds great. I went to go kind of just like slither out of the room and she goes, don't you leave me. You got me. I'm here. Because that's what's important, that whatever holistically, you don't want someone to feel like a watch pot, but you want them to feel well supported at the same time. And then certainly as labor picks up, right, we're getting closer to someone pushing. It sounds like transition. They're getting a little grunty. We're right there. We always have 2 midwives at a birth. So often it's the primary midwife, during that active labor. And then once things are getting like, okay, we're starting to get to where we're pushing, that's when we'll call the other midwife in. So we have at least 2 sets of hands, for us to welcome that baby.
Yeah. Oh, I just feel like, I went back to work in labor and delivery when I got here. And when people are going through transition in the hospital compared to a birth center, it's so different. And I remember this one birth, and like the client was really like losing it. She was really like energy wise, like I can't push anymore. This is really hard. Like she was really going through it. And you guys were just like feeding her honey. It was just like one of these things where it's just like, keep open your mouth, like giving that like energy. Whereas, in a hospital, it would be like directly like, it would be just something else. But I just feel like that's just like the picture of like that holistic of like, you're so close, you're getting there, and just these natural remedies that can change everything. And of course, she got a boost of energy.
I mean, we work in a shared care model. So, most people see 2 of us as primary, and then we all assist each other. So, we know when someone, like I attended a birth this morning, I was not the primary. I mostly got to sit in the corner and look cute and chart, right? I didn't have to do a whole lot. And, what happens is roles are assigned. So, who is on mom, meaning that person is going to catch the baby. They'll deliver the placenta. If there is a bleed, they'll manage that, or they'll direct people as to what they need. Another person is on baby. So that person would be in charge of baby vitals or resuscitation if there is a baby that needed a little extra kickstart when they were born. So those roles are predetermined by that team together. Because sometimes we'll have 3 midwives. We'll always at least have 2. Sometimes there's 3 people at a birth. So today there was 3 of us. My role was to chart. I loved it. The other 2 had their roles, and it worked out beautifully. If there is an emergency where there's a different, if there is an emergency, everybody has a voice. Everybody has a voice, and we've worked really, really hard to hit that home. So, one, we're drilling emergency drills monthly, in meetings and good communication and practicing different things. But it's always been like, if you individually don't feel comfortable about something and somebody else does, you always have a voice. So there's a lot of shared decision making within the team, but also with the family. So I tell people all the time, like, if there is something we're worried about, we're not keeping that from you. We're going to tell you, hey, when I was just listening right now, did you hear that? Your baby's heart rate went down a little bit. Let's change positions. I'm going to listen again here. You're bleeding a little bit more than I'd like to see. I would like to be able to do X, Y, and Z. is that okay? So on and so forth, so that not only is there shared decision making between the midwives at a birth, but also the family is taking part, and the person specifically that's giving birth, like that is that person's body. That is their body, that is their baby. Ultimately, at the end of the day, they have a say in what happens to their bodies, not, so their consent is also really important in decision making too. Something to be said about a really experienced doula. Obviously, to get experience, you have to get experience, and we all have to start off as little baby doulas and little baby midwives that don't have a lot of experience. um, it's the collaboration aspect, if it feels like we are all a team together. It's not, there are some doulas that work more in the hospital, and um, I think that they really hold strong to their like advocacy role as a doula, which is sometimes needed more than others in different hospital environments, different birth scenarios, different providers, where they feel like they need to protect their client, which is really valid. And while I also want them to advocate for their family that they're supporting in and out of hospital environment, I don't think it's actually it's not needed as much, because we have that really strong relationship. It's relationship-based care. It's a lot of consent. So, some doulas that are not accustomed to out of hospital birth in general, that can feel a little bit different. If I don't know if that makes sense, if there's like a barrier there, like I have to protect this person from you. But being Portland is such a small, well, it's a big birth community, it's a small birth community at the same time, right? A lot of us know each other, so it means we work with a lot of the same people. So I just had a beautiful birth over the weekend. I was a first time mama, and I was so excited, not only because I love this family, but because their doula I've worked with a bajillion times. So I just knew, number one, this family was going to be really, really well supported, that this doula knew what she's doing, and that we were just going to have this beautiful collaborative experience where she's supporting this family, but we're supporting each other too. So
Mhm.
that is really helpful. I have not had a lot of poor doula experiences,
Mhm.
straight up. Like any doula is it's a really good benefit for families. Sometimes you can tell the ones that are less experienced, and sometimes then we're doing a little more of the like, okay, I'm gonna get in there, do the hip squeezes, and let me show you how. um, but I always remember, like, we've all been there. We have to learn somehow, and you get more experience by having experience. For the immediate postpartum, the first couple of hours are always kind of busy. Really, of course, want to preserve that golden hour, right? So a baby is born wherever they come out, right? So sometimes it's in the tub. Um, my last two babies I was primary for were actually in the very same spot next to the toilet in the same room.
What?
Yeah, yeah, kneeling next to the toilet. But babies are born standing up, hanging on to the side of the bed, on the bed, in the shower, like, right? All the things, all of them happen. But regardless of where that is, immediately that kiddo just comes up on the chest. Um, we really want to obviously keep babies warm, but other than that, we're watching how that kiddo is transitioning. um, that after giving birth, that in person, that mama is not bleeding too much, everything is normal, right? But a lot of that can be done just with our eyes and not having to fiddle with someone a whole lot. So you can preserve their sweet bubble of, oh my gosh, my baby, my baby, my baby, we just did this, without a lot of extraneous people entering in that sweet bubble, unless obviously if there's anything that needed to be done, we're going to do it. But so really preserving that, keeping that baby on the chest, skin to skin. They're doing well, they're transitioning well, we're just hanging out waiting on a placenta. We we help people with like, hey, when do you want to cut the cord? I would say majority of the families choose to just wait till after the placenta is delivered because, when a baby is born, about a third of their blood volume is circulating between that cord and the placenta. And so just allowing them to get whatever they're going to get from that until the placenta naturally separates. And once the placenta is separated and out of the body, that circulatory system is now done, right? They're not going to get any more blood between those two. So it's really reasonable to cut the cord. That's most of our families will choose to cut the cord then. So that's a lot of that first hour is just then. Everything's stable. We'll often even step out of the room for a few minutes to just give them space before, coming back in and doing the practical things like, hey, can I check your bottom? Make sure you don't need sutures. I like to save the newborn exam for the very, very last thing, because then we've maximized this time of this baby being on their parent's chest, one or the other, before, even though in the newborn exam, we're doing it on the bed next to them, it's still, then I'm like, hey, can I just take your baby for a second? I want to maximize that time uninterrupted. Our birth center families generally will stay for 6 to 8 hours. I know that's not true for all freestanding birth centers. A lot of freestanding birth centers will discharge after a few hours, 2 to 4, depending on where you are in the country. We will generally keep people 6 to 8 hours, and that looks like feeding them and getting a nap in, ideally, helping with breastfeeding if they're choosing to breastfeed, making sure just everything is stable and that they feel good before they head off home, right? And then we do a home visit that next day, and then on day 3, and then see them back in the clinic at 2, 4, and 6 weeks, and certainly more visits if there needs to be more. So if there's jaundice or we're worried about that baby's weight or other things going on, we're always happy to do additional visits. But again, those are, usually an hour. Sometimes the home visits are more. And we're checking on both the mom and the baby, right? We want to make sure everybody is doing well, as opposed to you just gave birth. It's, 2 days later, go to the pediatrician. Like, we're able to provide the first 6 weeks of that well baby care in order to keep, ideally, people home and cozy for as long as possible.
Mm. Oh, love it. Oh, it's so magical when it all can just like go so seamlessly, and that they get that support like 24 hours after, 3 days after, when so much is happening with that person. I will never stop fighting for it here or no matter where I go in the world of like advocating for this type of care, because I've seen it now. I've seen so many hospitals, so many birth centers and home births, and I'm just like,
I agree. And, nature is not perfect and bodies are not perfect. And, the interventions out there, they exist for a reason. Nothing is black and white. And I tell people all the time, like, we have tools for a reason. We use them when we need them. If you are doing a project and you don't need a hammer, you're not going to use a hammer. If you need a screwdriver, that's what you're going to use. And it's the same thing in regards to birth. Like, if you need those things, we're really, 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 really grateful that they exist. The hospital is a tool. Pitocin is a tool. C-sections are a tool, when used appropriately, that they can be life-saving. But also, like, we shouldn't be using them just because willy-nilly. It's all about appropriate use of tools. And part of just getting prenatal care is that really baseline assessment. Like, is this still normal? Is this still low risk? Is there something we should be keeping our eyes out for? Is there something else that we should be doing? Like, is somebody anemic, or is their blood pressure keep creeping up, or so on and so forth? Because then we have the ability to utilize the tools that we need to. And then if everything is normal, great, let's let it be normal.
yes. Oh,
And stories I could tell all the time. But what I would like to tell you is, well, since you have moved out of our area, I have attended a handful of births of repeat clients who that you attended their previous birth. And number one, Alison shaped hole in the world here. Like, and then so everybody has felt that. And two, it was so fun because I had one not even 2 months ago, a really, 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 really dear family. And you and I attended their first birth together. And they used a doula who is one of your who works in the same practice that you did. And it was so beautiful to watch because she did things just like it was so much like you. So it was, yeah, it was so sweet to watch. I was like, that you look like Allison. So yeah, just know that, yeah, everybody here misses you. You're such a valued piece of the community, and yeah.
Oh, thank you so much. Like, it means so much. And I love Portland. I love all the community that I got to know during my time there. And we still have plans to come back. And it's still on our, manifesting vision board. And so I really miss it every single day. I truly do.
Yeah, having that community and that support, it's easy as birth workers to kind of burn ourselves on both ends of the candle. What is that saying? But having support so that there can be some sort of semblance of work-life balance, and we're able to fill our cup. See, there are breaks to fill your cup, whatever that looks like for different people. So no shade to the solo practicing midwives, but I think that I myself benefit from that shared practice. And I think that our families do too, because there is always the option of, Laura Erickson, our director, calls it a fresh horse, which is hilarious. But just, I know, I remember I was up with a family all night once, and I don't know, it was like 5 a.m. and I felt like I was starting to see double. And usually I do fine being up all night. And then after the birth is over, then the adrenaline wears off and then I'm toast for however long. But for whatever reason, like, I cannot see straight. I need to take a nap. And I knew I could call my partner midwife and say, hey, can you come here for a few hours and, help me out so I could take a nap. And so having that collaboration, it gives sustainability to this kind of work. So it is really, really needed and valuable.
Oh, absolutely. No, well, Janelle, I'm so honored to know you, and I am just so grateful for your time and talking all things about midwifery care and just all the ways that we can really have a collaborative sense of care in this world. And I just love what you're doing and how you're helping so many families in the Portland area. And just, yeah, love you and miss you so much. And yes, just again, thank you so much for your time today.
Likewise, love you and miss you too, and cannot wait to hear all about this sweet baby that you're going to have soon.